Hi, my name is Callie Hatch, and this is the Pregnancy Assessment Lab. I'm going to start with normal and abnormal findings and then break down some things that may be considered abnormal to a normal person but are normal during each trimester. So first of all, I would walk in, I'd introduce myself. Hopefully I already have an assessment of where this person is at in their trimester, but if this is the first visit, I'm going to start with a complete head-to-toe survey, asking history and things of that nature. So once I've established that I have the correct patient, asked their name, date of birth, told them what we're going to do today, and got consent from them, I would make sure there was privacy, so there are no HIPAA violations. I would first do my assessment off observation. I would observe the state of their nourishment, look for if they're a healthy BMI of 19 to 25, note grooming, posture, mood, and effect, which can reflect their mental status or even possibly their risk for depression during postpartum. It'll also show me possibly if they have any issues obtaining nourishment or maybe impoverished and need more assistance. So once I also see their presentation, I'm going to look for any abnormal bruisings, which could indicate any abuse or self-harm. Look for track marks that might be visible, that could indicate drug use, obtain the vital signs and current weight. I would take their blood pressure, especially because you want a baseline blood pressure to check for preeclampsia in the future. I would also recheck blood pressures that seem abnormal just to make sure it's accurate and make sure the proper blood pressure cuff is used to get a real precise assessment of the blood pressure. Do not take it if the patient is nervous or anxious or upset. Weight should be measured to see what their weight gain is going to be. Again, an excessive amount of weight gain or weight loss is concerning. So abnormal findings would include undernourished or obese. So first trimester weight loss of over 5%. Pre-pregnancy weight may indicate hyperemesis or gravidarum. I'm sorry, I'm a little tongue-tied. Once I've done my visual assessment and my vitals, I would assess skin changes such as acne or skin tags. These can occur during pregnancy. Vascular spiders or varicose veins may be present on the upper body, and on the legs. Some people have a mask of pregnancy, which is a butterfly-shaped pigmentation of the face. I know my mother actually got different pigmentation on her neck when she was pregnant. We can look for, if it's later in the pregnancy, we can look for the linea nigra or hyperpigmented line that begins at the sternal notch and extends down the abdomen through the umbilicus to the pubis. I also note for striae or stretch marks. They may initially be red on lighter skinned people, but will turn more towards the skin color or light pink on like light pigmented people or dark on darker pigmented people. You also might have what's called PUPP, pruritic urticarial papules and plaques of pregnancy. It's most common pruritic skin rash during pregnancy, more common in Caucasian people. It has an intensely pruritic erythromatous eruption that appears late in pregnancy on the abdomen and thighs. Then I'm going to move to the facial area where I can see if there's nasal congestion and nosebleeds. This can be normal during pregnancy due to increased blood volume, but if it is more like irritation, crusting, stiffness, or recurrent nosebleeds, it may indicate drug use. So that may be something to look for. Mucous membrane should be dark pink and moist, but and the surface should look gum surface should look smooth and stippling. But if the gums are pale, that could be anemia. If they're excessively bleeding, that could be an issue. If they have poor dental hygiene, this is something I learned that I didn't know. It may lead to PTD or low birth weights. Bleeding gums may be a form of estrogen stimulation and are considered a normal finding, but excess bleeding could show that there could be complications with the child. The thyroid may be palpable and feel full but smooth during normal pregnancy, but solitary nodules may indicate neoplasm. Multinodules may indicate inflammation of a multinodular goiter. Enlargement can occur with hyperthyroidism, thyroiditis, or hypothyroidism, and should be reported, or hypothyroidism, sorry. Breast changes happen a lot with pregnancy, so breasts may be enlarged and can have striae and be tender. The alveoli and nipples can enlarge and darken in pigmentation, especially in the later stages of pregnancies. The nipples can become more erect, and a secondary areola may develop. The blood vessels of the breast enlarge and may shine blue through the seemingly more translucent, especially with Caucasian patients. When auscultating, blood flow can be heard, called the mammary souffle. Montgomery tubercles enlarge. You also may get a thick yellow fluid that is colostrum. This may be expressed from the nipples later in the pregnancy as well. The breast tissue feels nodule as the mammalar alveoli hypertroph. Any abnormal masses within the breast, though, should be reported, and further evaluation should be done with an ultrasound. While you're in the breast area, you can go down to the apical pulse. The apical pulse is left of the mid-clavicular line and up to the fourth intercostal space because of the fetus pushing on things. The pregnant person often has a functional, soft blowing systolic murmur that occurs as a result of increased blood volume. But any other murmur is considered abnormal and should be reported. Chest pain also as well should be reported immediately because pregnancy can put stress on the heart in a pregnant woman. You can also listen for the lung sounds. They should be clear bilaterally, even though they may report some minor shortness of breath due to pressure on the diaphragm. They should still be clear to auscultation. Crackles and wheezings are abnormal, and the patients with asthma may experience wheezing and have asthma attacks, so you still need to assess for wheezing. Dyspnea, crackles, congestion, cough may indicate a respiratory infection. Any respiratory distress should be reported and evaluated immediately, as that could be an emergency. Sorry about the dogs. Using the reflex hammer, check the biceps, patellar, and ankle for deep tendon reflexes. Normally, these are 1+ or 2+ and equally bilaterally. Brisk or greater than 2+ deep tendon reflexes, and clonus may be associated with elevated blood pressure and cerebral edema in preeclamptic persons. The legs may show diffuse symmetrical bilateral pitting edema. Edema, together with increased blood pressure, is a sign of preeclampsia. Edema and pain in one leg may occur with DVTs. Redness or red hot tender swelling can indicate phlebitis. Observe the legs for varicosities, as they will worsen with the weight and the volume of the pregnancy. Patients should be advised to elevate their feet and wear compression stockings to minimize edema and DVT risk, but you need to teach them the signs of DVT and advise them not to rub the legs if they suspect DVT. This is oftentimes just in one leg, not in both, so that's a telltale sign. They need to report those symptoms and seek care immediately. So now to the abdomen, because this is a huge assessment, right? Observe the shape and contours of the abdomen for fetal position. As the person lifts the head, you may see the separation of the abdominal muscles, which occurs during pregnancy. When palpating, note the abdominal muscle tone. It normally grows more relaxed with each pregnancy. So if they've had multiple pregnancies, their tone may be less. Note any tenderness, as the uterus is normally non-tender. Any abnormal enlargement and pain with palpation can indicate an ectopic pregnancy or ovarian mass. Those can be deadly in certain circumstances, so need to be addressed immediately. The fundus should be palpated abdominally from 12 weeks gestation. Use the centimeter measure tape to measure the height of the fundus in centimeters from the superior border of the symphysis to the fundus. Fundal height should be greater to equal to 2 centimeters. Fundal height that is greater or equal to 2 centimeters may indicate intrauterine growth restrictions, transverse lie, or oblique presentation of the fetus. Fundal height greater than 4 centimeters may than expected occurs with multiple fetuses, excessive neotic fluid, or uterine myoma. In the third trimester, the Leopold maneuver will be done to determine fetal lie presentation, attitude, position, variety, and engagement. Ask the patient about any. So after I look at the stomach to see if there's any normal or abnormal findings, I'm going to ask the patient about any enlargement of the labia minora or labia verticosities. The perineum may be scarred from previous episiotomy or from lacerations, and a full history of previous pregnancies, complications, or childbirth procedures should be documented. Attain if there are any hemorrhoids or bleeding. Excessive rectal or vaginal bleeding should be reported immediately. Vaginal bleeding can occur with ectopic or lost pregnancies. Patients may also experience Chadwick sign, the bluish-purple discoloration and congested look of the vaginal walls and cervix from increased vascularity and engorgement, which is a normal finding. Question the patient about any lesions or vaginal discharge. Lesions may indicate an infection, condyloma, or genital herpes infection. Discharge may be heavier in amount but should be similar in description of person's non-pregnant discharge and should not be associated with itching, burning, or unusual odor. Itching, burning, or odor could indicate a UTI or STD, and immediately testing should be obtained. Purulent drainage could indicate chlamydia or gonorrhea. Yellow or green frothy discharge could be trichomoniasis, and thin white grain or milky fishy odor could indicate bacterial vaginosis. A thick white and clumpy discharge could be candidiasis or a yeast infection. These conditions need to be immediately tested and treatment, as they could be harmful to the fetus. Some symptoms may seem abnormal for a non-pregnant patient, but completely normal during various stages of pregnancy. Patients should be made aware of changes that can occur in each trimester for better understanding. So in the first trimester, physical changes a woman may experience include enlarged uterus, amenorrhea, breast tenderness, nausea, vomiting, fatigue, and increased urinary frequency. Cardiac output and blood volume initially increase, but by week 7, the blood pressure starts to drop due to falling peripheral vascular resistance. During the second trimester, symptoms such as nausea, vomiting, urinary frequency, and fatigue improve, but breast enlargement continues. Fetal movement begins, nipples and the midline of the abdomen darkens, and stretch marks may appear. The blood pressure may be slightly lower than baseline, and by 20 weeks may actually cause dizziness or faintness. Mothers may also experience heartburn and constipation due to the fetus misplacing GI organs. Respiratory effort may also increase, and the mother may also experience dyspnea. Decreased vascular resistance can cause nosebleeds and minor gum bleeding. By the third trimester, erythrocyte mass increases caused by an increase in erythropoiesis, due to changes in hormones. White plasma volume increases slightly, causing hemodilution, and a drop in hematocrit, and blood pressure slowly rises again. The enlarged uterus causes a shift in the diaphragm, limits lung expansion, and can cause shortness of breath. The shift also shifts the heart up and to the left, increasing cardiac output, stroke volume, and force of contraction. The pulse rate rises 15 to 20 beats a minute, and possible murmur can occur. It should be a minor, soft murmur, not a predominant murmur. The fetus can impede venous return, causing edema and venous congestion in the legs, vulva, and rectum, and constipation can lead to hemorrhoids. Lordosis can cause backaches and increase breast size, and weight can lead to aching and numbness of the arms, hands when the fetus drops. Urine frequency occurs again, vaginal secretions increase, and lung capacity increases. Eventually, the cervix will thin and dilate, and a mucus plug will be expelled. After 20 weeks, the fundus measurement in centimeters should be approximately the number of weeks gestation in a person with healthy body size. Beginning at 20 weeks, you may feel fetal movement. Further investigation should be done if the fetal heart rates are less than 110 beats a minute or over 160 beats a minute, or irregular, as that's an abnormal finding. I think it's really important that we make sure that we educate the patients on what changes may be expected during the trimester and at what point they are not normal and they should be reporting. Just because we know that there may be nausea and vomiting, if they are constantly having nausea and vomiting to the point they're losing weight or can't keep anything down or are malnourished, that becomes an issue. So we need to really educate on the discrepancies of what to expect versus when it is a big problem. I know that there are multiple pregnancy emergencies that can occur, but I think the most common one that we really worry about is preeclampsia. This is when the edema happens, high blood pressure. It can be fatal. It's really important that they understand the symptoms of preeclampsia. I think right after pregnancy, a big one we need to worry about is postpartum hemorrhage. They should be explained when it is appropriate to seek further care, as normal bleeding right after pregnancy is expected, but when there's a hemorrhage, obviously there's going to be more blood. It is more of an emergent condition and again can be fatal. Before a pregnancy really gets too far along, you may have signs of ectopic pregnancy, which again can be fatal to the mother. You often will see bleeding or major tenderness, abdominal pain, things of that nature. All these things should really be explained to patients, and I really think that there's a lack of education at times for pregnant mothers. I know that there's things that tell us what we should expect, but I don't think there's a lot of talk about when those normal findings become an actual emergency or when they should seek care. That is my assessment. After I did patient education, I would document any abnormal or normal findings. It's important to document so we can trace any occurrences of abnormalities or any complications that may be arising. Being on top of this is really important to the health of not just the mother, but the fetus as well. That is all, and good night.